conflict. Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa Anti-Aging and Wellness, and we're a little bit late for our 12, but that's okay. We figured it's better late than never, right? So it's our Wednesday show, and today we thought we'd talk about Coolsculpting because we have a lot of really great specials going on with Coolsculpting right now. And I'm gonna grab our little consult book, and I'm not gonna go through everything, but I'm a very visual person, so I like to show all the different areas that we can do. Before I get into that though, Coolsculpting is a great procedure when you just have a little excess fat that you just can't get rid of. So it's not a weight loss type of treatment. It really is that you've got a little extra that you can squeeze. Maybe it's your stomach, and we'll talk about all the different areas, but maybe it's your stomach. You feel like, oh my gosh, I work out all the time, but my stomach still sticks out. My clothes are a little bit tight. So that's really what Coolsculpting is made for. It's not, again, it's not a weight loss kind of thing, but you do lose inches with it, so your clothes will fit better. So we've done over 2,300 treatments with Coolsculpting. We have had the machine for going on 8 years. I think next spring will be 8 years. So we've definitely, we love this treatment. We've definitely done enough of it that we feel extremely confident that we see great results if the treatment plan is done the way that we recommend it and the way that it's supposed to be done. So just some of the statistics here is that Coolsculpting alone has done over 6 million, and I almost feel like they're at 7. This book might be a little bit old, but they've done a lot of treatments, and we've had the machine almost as long as it's been out, and that again, it's proven results, and that's what we really like because our patients are very happy. When the fat cells are frozen and we excrete them out of the body, those fat cells are gone. So I like to explain it. Let's pretend like we have 1,000 fat cells in our entire body, and this will freeze off, let's say 100 of them. Those 100 fat cells will never come back. You still have the other 900 fat cells, and as you gain weight and lose weight, those fat cells are going to expand and contract. So you're going to get rid of the ones that we freeze. They're never coming back, but you still have that chance if you put on 15 or 20 pounds that you will put on that weight again. So don't think of this as an end-all be-all, like, oh, I'm going to get rid of everything, single fat cell. That's not possible. So let's see, what else we have here? So this is what I was talking about, that you have these fat cells, and we freeze those, and we get rid of, this is breaking it down, and then here we get rid of those. So you get rid of a percentage of the fat cells. So I think that's actually a great diagram to show you that you're not getting rid of all of them, but you are getting rid of a lot of them. This is the area, these are the areas that we can use Coolsculpting. So we have under the chin, we have bra fat, back fat, you have your arms, your flanks, your love handles if you want to call them that, your abdomen. When we do abdomen, we usually do upper and lower abdomen, but some people can get away with just the lower. You can do underneath the buttocks, or what we call the banana roll, and you can do your inner and outer thigh. So there are quite a few areas that you can do. I would say the treatments we do the most are the abdomen treatments, the flanks. Then all these other guys is kind of they added on after the fact, or if their chin's really bothering, obviously they're going to start there. So the beauty of this is that really you can, we always say if we can squeeze it, we can freeze it. So if you have an area that's bothering you, let us take a look at that. Which brings me to consultations. So a lot of patients will call up and they'll say, oh, how much is it? Well, it's too hard to tell you over the phone because we need to see you in person. We need to see if, one, you're even a candidate, because a lot of people aren't even candidates for it. If you're, think of that beer belly kind of guy. If you have that big beer belly where we can't squeeze it, you just can't do Coolsculpting. So we don't want to give you misinformation over the phone. We want to make sure that we tell you the right treatment plan. So when you're thinking about Coolsculpting, you're thinking about treatments, number one, you want to go to a clinic who has a lot of experience. You want to go to a clinic where the doctor is involved and the doctor understands what's going on and is part of that treatment plan. all of our team members who do Coolsculpting have been to Coolsculpting University. So again, I feel extremely confident in our treatment planning. And as long as you follow the treatment plan, you're going to have great results. So let's look at, actually this is a neat picture, so I'm going to zoom in on that. So this is before, this is after weight loss. So your cells they're the same amount of cells, they're just smaller. And then this is after Coolsculpting. So you have less cells. They're the same size, but they're less. So same amount, but a smaller size, less amount, but the same size. Does that make sense? So I think that's a really cool picture, because I think that explains it very well. As I said, with weight loss, your cells are just shrinking. They're still the same amount of cells, they're just shrinking. All right, so this is actually a great picture of what it looks like when you are on the Coolsculpting machine. So you can do anything else that you want to do. They're 35 to 45 minute treatments, just depending on which one. And the first 5 minutes is where the machine is sucking in and it's pulling it, and you'll feel a little bit of, I would call it pressure, and it takes about 5 minutes before it actually freezes completely, and then you don't feel anything. So I have a couple of the hand pieces. So this is actually the Cool Advantage. This is probably the one we use the most. I call it the purple one. And we attach these hand pieces, or these, I don't know, these, we can do all different sizes. So if you have a little bit more fat, we can do, pull this one, and it's gonna pull more fat in there. But if it doesn't quite fit in here, then we have this one. So you have all these different options. And this one is a bigger option. So when we're doing lower abdomen, we'll use this one along the lower abdomen. So that's the beauty of this too, is it's not only if we can squeeze it, but it's really finding the right hand piece. And every area is just a little bit different. So,
and everybody. So that's why we have you come in for the consultation, so we fit you to that piece.
That's right. That's exactly right. Thank you. So we fit you to the piece, and that's why it's very challenging, you know, when you're calling on the phone and say, well, I mean, this is what's going on, but you really need to have a complete treatment. So think about it this way. If you say your abdomen's bothering you and you only treat the lower abdomen and this gets smaller, this is going to be sticking out. So it doesn't make sense. You really need to treat the upper abdomen as well. And the same if it goes the other way around, like if you treat the upper and don't treat the lower, well, that a lot of times doesn't make sense either. The other thing is that when you're treating, sometimes it makes more sense to actually start out here instead of doing this. So that's the artistic part of Coolsculpting. Anybody can just take it and stick it on, but really you have to look at the whole picture and you have to decide, well, what's going to be the best option? And sometimes we don't go directly here. Sometimes we'll angle it a little bit differently. So it's actually, I think, a very fun treatment, because you really do have to look at the body and figure out where are the fat pads, what's going on, how do we make this work and give us the best results. So anyway, so back to the machine is hooked up to you, and you're on for 35 or 40 minutes. At the end of that, we take it off and we massage. So during the treatment, it really doesn't hurt. Right after, when we're massaging, that's probably the most uncomfortable part, which, again, not painful. It's just uncomfortable because we're trying to break up all of the frozen areas. So patients don't love that part of it, but again, it's not painful. After that, you can have a little bit of swelling. It can last up to a couple weeks. You can have a little bit of numbness. I remember when I had my stomach done, you know, you would feel like you had a scratch, and you would try and you couldn't really feel it. So a little bit of numbness there. And that again is like a couple weeks, sometimes up to 30 days, but most of the time just a couple weeks. And let's see, so swelling, what did I say? Swelling, a little bit of tenderness. When you bump into it, you would feel like you were bruised or something. It doesn't really hurt afterwards. I personally like to have the compression, like my stretch pants, like I wear every day, my compression garments on to kind of just give it a little bit more support. Some people don't like to have that extra support, so it's really just what you're comfortable with. The the treatment plan that I keep talking about is that we give you a plan from the beginning. And if it's, let's say you're doing upper and lower, you'll probably do one here, one here, one here, one here. And then after 30 days, you're going to repeat that. Now, if for some reason, we evaluate and something has changed, then obviously we're not going to do all 4. That's the other thing. It's like we're not just going to stick them on there because that was what the original plan was. We're going to reevaluate at 30 days and see what needs to happen. The thing with Coolsculpting is that you may or may not see something at 30 days. It actually takes 3 months after the second treatment to see your final results. So you may see something at that month mark, but we don't get too worked up if we don't see it. We like to have you come back. I think we come back at 60 days and then back at 90 days, and that's when we take photos again. I say this all the time in these videos that we forget what we look like. So sometimes you might feel like you don't have any change, but when we review the before and after photos, you actually have quite a bit of change. So that's what we find so important in this clinic, not just for Coolsculpting, but for every single thing, is you have to take photos. You have to compare before and afters. And I know a lot of you are probably sitting out there thinking, well, surely I'm not going to forget what I look like. Believe me, you do. I did it myself, looking at my before and afters. I was like, oh, I didn't know that, I looked like that before. Look at how much better I look. Haha. But that's the thing with Coolsculpting for sure, is that you have to see your before and after photos. So very important for follow-up. Let's see. What else, Steph? These more results. These are not my photos, but let me show you some photos. And what I like about these is that you can see where this person was treated. So this person, this is the before, and that's your after. And here's where she was treated. It was lower abdomen and flanks. So
tilt it down.
Tilt it down, sorry. Is that better?
Yes.
Okay. So before, after, and here's the treatment. So looks like she had 2 golds and 2 purples probably, which is the technical term for Coolsculpting hand pieces. That really truly is what they used to be, and so I'm still old school. And so let's see, can you see these? Mm-hmm. Okay. So this is your before, 23 weeks after, and this patient just had upper abdomen treated. And then this is before and 5 months after. And this person, see how they actually, because they have a very long torso, so they had directly, I'm sorry, I keep going back and forth. They had directly under here treated, and then their upper and their lower. So what this shows is that this is, it doesn't say if it's 5 months. It should be 5 months after that first treatment. But I mean, those are pretty impressive results. And what's interesting with this one is that they didn't treat the lower abdomen, and you still see really nice results. I think they could use a lower abdomen treatment on there if they want to see even better results. And again, these aren't my treatments or treatment plans, but I think you can see some nice change. I like to show mine, but as you all know that watch all of these, you can't see them on the computer as well. So this one is just the outer flanks there, and that's lower abdomen. So your before and after. Pretty cool. Let's see if there's any chin, if there are any chin photos in here. Got a chin in there. Thanks. Yeah. Oh, here we go. Let's look at that. So this is quite impressive. It doesn't say, it just says after second session. So for this gal, I would have treated a side by side. For this one would have been straight on, and this one probably straight on. So you can really see, and these, even though they're not my patients, we absolutely do see these results. So look at the difference in the side profile. Pretty impressive.
And it lets you know that you could possibly do more than one treatment.
Absolutely, you're going to need the 2. And sometimes, especially chin, especially the lady at the top, I mean, that's quite impressive with just 2 sessions, but sometimes we will throw a third one on there if we feel like we need it. So as I said, the main reason, here's a good banana roll actually. And actually the banana roll was the first place that I ever did, and I loved the results. So she had 2 treatments right in this area, and you can clearly see a nice change there. So I love looking at before and after pictures. I really feel like that makes it makes such a difference to be able to make an informed decision of whether or not you want the treatment. You know, in understanding how the Coolsculpting works and that everybody is different, you might not have the same results that these patients have. You might have better results, you might have a little less results. So you just don't know. And I think that's the hard part about aesthetics, is that you don't know until you try it, and you want to make sure that you're making an educated decision and making sure you're making the right decision for you, which is something that we can help you with. The reason why I decided I want to talk about Coolsculpting today is because Coolsculting is doing this Take Yourself Further campaign, and so they have an extra $500 off rebate going on right now. And so what we've done is we've actually combined that rebate with our special pricing. So we have decent pricing going on right now. And this is a great way, if you've already had Coolsculpting, maybe to add on another area, or if you haven't had it, that maybe you can get the whole abdomen treated and not have to worry so much about cost. So we offer consultations for our Coolsculpting. We offer it for everything, of course, but our Coolsculpting consultations are complimentary, and because we're not sure if you're a candidate. So we would love to see you. If you have any questions and you don't want to post them on here, we'd love to have them on here, but if you don't, you can private message us, or you can absolutely give us a call. I'm going to tell you, we're not going to give you pricing over the phone, as I said, because it's just too difficult. But we would love to answer any questions that you have and see you in person so that we can take care of you and help you with any excess fat that you want to get rid of. So if you have any questions, give us a call at 618-288-9117.